Hi, KSB community. I am Nicole Sutton, and I am the manager of Patient Access. Today, in our Patient Access series, we will be talking about the importance of registration. So, the importance of registration, some of the topics we will talk about today is what exactly is registration and why do we have to do this every time? What exactly is verified? They do not have the correct insurance information on file. What happens then? What should I bring with me when I register for my appointment? And can I pay my balance at registration or will they ask me for a copay? So, first and foremost, we're going to start by speaking about what exactly is registration. So, registration is where we are going to want to verify your main demographics and your insurance information before every appointment that you have with us here at KSB Hospital. And we do this not only to make sure that all information we have in file is correct, to produce a proper bill, an accurate bill, but also we want to make sure that we have the correct patient in front of us as well to protect your security. In doing this, we will produce a clean registration. And a lot of times people will think, what is a clean registration, or not know much about a clean registration? And a clean registration is when we produce a successful bill, which that means then we've verified all your demographic information, we verified your insurance information, and everything is correct on file. So when we submit your claim, if you will, your encounter to your insurance company will then pay it out. So what exactly do we verify at time of registration to be able to produce a successful bill? We will verify some of the main demographics such as name, date of birth, social security number, address, employee, and most importantly, insurance information as well. And we ask you all this information because, like I said, not only to make sure that we have the correct patient in front of us, but also this is the information we need to produce a successful registration, a successful claim to bill you most properly. What exactly happens when we have the wrong insurance information on file, and what does this mean? So when we do have the wrong insurance information on file, we are not going to be able to bill you most accurately, and you are going to receive a bill in the mail that does not either have the correct services or even the correct insurance on file. So this is really important why we need the correct information on file. And with insurances changing so much, sometimes that may be hard to keep up with, right? So lean on us to help you. Here at KSB, we have a tool that helps us verify that correct insurance information by manually looking you up. If you, for instance, an example, if you have a certain type of Medicaid insurance, but you're not quite sure if it's Aetna Better Health or Meridian Medicaid or Molina, if you will, we have the resources here at KSB to look your information up and verify what exact Medicaid information you have so we can input that into your registration. And it's time for your appointment. What should I bring with me? So most importantly, I know we always tell you this, and you always see this on your reminder appointments as well, reminder messaging that you receive on via text, to come 15 minutes prior to your appointment. And we ask you to come 15 minutes prior to your appointment to make sure we can get all this correct information on file. But what we do need when you do come in 15 minutes early is we really need a photo identification. And a lot of people will wonder, well, how often do you need that photo identification card? And that answer would be, we do need that scanned in once a year. And secondly, we would want to talk about your insurance card. We do need that as soon as possible. A lot of people will wonder, why do they ask me so much if I need my insurance card scanned in? And well, the correct answer is we definitely do need that as much as possible just because of all the insurance changes that do happen. We just want to be able to keep up with those insurance changes to make sure we have the most accurate information on file at all times. And any applicable copays that are reported to your insurance as well, we want to have those ready at time of service as well. So will I be asked a copay every time I register? So a lot of people get confused about this because they think, well, I had two different appointments today and they asked me for a copay at both different appointments. So that may seem confusing, but really how it breaks out with your insurance company is that every time you have a different appointment, we are going to bill you differently for each appointment. The only time you will not be asked a true definite copay is if you are having a post-op appointment, a pre-op appointment, a OBGYN appointment, or an annual wellness or a well child visit. We do not ask copays for any of those, but really it's based on what your insurance reports to us. We receive this information to us via your insurance company automatically every 48 hours. And then we also have the option to look up this information manually as well. So when we receive this information prior to your appointment. But if you're not quite sure yourself if you possibly have a copay, this is something you can also lean on us with as well. You can call in and we can provide that information for you as well. And then a lot of people wonder if they can pay their bill at time of registration as well. And the easy answer to that is most definitely. Our team has, the patient access team has the access to look up that information right at point of service, and they can tell you exactly what you owe and help you process that payment as well. So thank you. Thank you for joining me today in this episode of the Patient Access series. If anybody has any suggestions or questions, or if there's any information I have left out in the fellow episodes that I have provided as far as insurance information, what exactly we do at point of service and the different types of insurance. If there's anything that anybody would be more interested to hear about, please do not hesitate to reach out to me at nsutton@ksbhospital.com. All right. Thank you.